Hey everyone, setting it up here. Okay. Hopefully everything is working. So we're just going to be doing a kind of Q&A today, just answering some of the questions that you guys had. And I won't be getting to all of them today, but I just picked 3. And then I'll do the others at a later stage. Then I just wanted to do a little update before we get started. So the first thing is I'm going to be doing a workshop at the end of this month, end of July. So that'll be the last weekend of July. If you do have any kind of preferences around the time, it'll be over a weekend. So I'm going to be doing it either on the Friday and the Saturday or the Saturday and Sunday, but it'll just be like an hour on each day. It won't be like a whole day workshop or anything. It's just like an hour over an hour per day over 2 days. So let me know if there's any like preference. I probably will do it around 4 p.m. and I was thinking on the Saturday and Sunday on the last weekend of July. Just maybe get those dates. That's the 29th and the 30th. I've got that correctly. So yeah, I will probably just do it on those days. But yeah, if there is any preference for that, just let me know, because it will live in the Facebook group after. So I will upload the recording to the Facebook group, but I will do it live on Zoom. And I'm going to be giving away one of my intensive sessions to someone that joins live. So I'll be doing that kind of a draw thing with the people that join live. So that'll be an intensive session. I do like a 4-hour intensive session over either kind of spread out over 2 days or 1 day. And that's kind of to dive deep into 1 or 2 areas that are particularly important to you. So I'm going to be giving one of those away to someone that joins live. So if you are wanting to join live and you have any like preference over those times and days, just let me know. And the second thing I wanted to update on is I'm opening 2 slots in my one-on-one coaching, so my 3-month one-on-one coaching program. So if that is something that you're interested in, we dive deep into all things related to your health and recovery, things like sleep and other forms of rest, nutrition, exercise, and then things like mental and emotional recovery, particularly for women clinicians. But that is a 3-month program based on like what your specific needs are, getting you going from that place of like burnt out and stressed out and exhausted to actually being lit up by the work that you do and actually having energy and being able to do the things that are really important to you. So if that is something that you are interested in, just send me a message and we can chat about the details of that. So that was just my update. And now we're going to get into some of the questions. So the 3 questions that I'm just going to discuss today are, the one was a question about dealing with the stress of practice being slow. So like some months it goes well, some months it doesn't go so well. And how do I deal with the kind of stress of that? The second one was setting realistic expectations with patients, how to do that. And then the third was like a combination of 2 questions. The one was dealing with difficult patients, and I sort of combined that with the question of like, how do I set boundaries with patients, because they're kind of related. So we're just going to be diving into those things. And this is not like oh, let me tell you what to do in these situations, right? Firstly, I would have to know so much more about the person that's struggling with this and what exactly their situation is. Usually in a coaching situation, this would be kind of a back and forth, right? Like identifying what your beliefs are about it, what your assumptions are, what have you tried in the past, how did people react in the past, etc. And what is your particular kind of work situation. So there would normally be like quite a bit of back and forth. So obviously I'm doing this without that additional information, and I'm wanting to do it in a way that it's relevant for multiple people. So it's not specific about one person, but it's kind of looking at the different aspects of this and how can you apply that to your situation to help you where you are. Sorry, this sometimes goes a bit like dark and then light. Anyway, okay. So hopefully you can see me properly. So if you think like, oh, this is more like a question and question than a question and answer, you'll probably be quite accurate, because it's more kind of about me kind of getting you to reflect on certain things so that you can get closer to an answer that is tailored to you, rather than just giving you kind of, blanket advice. So we're going to go into the first question, and you'll see kind of themes popping up in these questions where I'll be kind of mentioning similar things. And then there are more specific things related to those questions. So when we're asking, how do I deal with stress when the practice is slower? So whenever we have a question, we also want to think about like, what is the question behind the question type thing? And there might be multiple, right? Are we actually asking about the stress of it, and like, how do I better cope with that stress, right? Can I implement stress management practices, or how do I take my mind off that stress when the practice is slow, whatever it is? Or am I actually asking, how do I not have slow days in my practice? Or how do I get more patience? Or how do I, on the business side of things, how do I make sure that my practice is running well? So they can be many like questions behind the question in many of these examples. So really get specific on like, what is it that you really want to know? And then one of the themes that often kind of comes up when we're asking these questions as well is thinking about, am I accepting the reality of what is? In other words, am I saying I don't want practice to ever be slow, right? Are we saying like, I expect that if I run a practice that every month is going to be full? And most of us would say no, right? We know that we're making kind of a trade-off when we're making this choice. We're saying, I want to start my own practice, and I accept that there are going to be risks involved. There are going to be some months where maybe it's going well. There are going to be other months that it's not going so well. I'm going to have to deal with things like, maybe hiring someone, a receptionist or another practitioner in my practice, or whatever it is. We know that we are making certain trade-offs, right? We are not really expecting, if we kind of think about it, right, we're not really expecting that everything will just go smoothly and everything is going to go well, and we must never be stressed, and we must never have any difficulty, and we must never have any discomfort, right? And we all kind of know that intellectually, but sometimes when we are resisting something, or when we are dealing with the discomfort or the stress or something, we almost have this subconscious assumption that it should be different, right? We don't really want that discomfort of things not really going well. We don't really want that stress of maybe not making as much as we wanted to this month, or whatever it is. So just being aware of that tendency of, am I actually accepting that this is the reality, right? If I want to start a practice, this is the reality of it. And now what do I do? What do I do with that reality, right? So then we want to think about, like, what are my thoughts and assumptions about when the practice is slow? So let's say, firstly, just the framing, right, of the practice is slow. What does that actually mean? If you have to have like the neutral version of that story, it just is this is the number of patients I'm seeing this month, right? And then we have certain thoughts and beliefs and assumptions about that number, that it shouldn't be like that, or maybe that if that is the number of patients, I'm not going to make my rent this month, or whatever it is, right? We have thoughts about that that then make us stressed about that neutral number of patients, right? And especially when it goes up and down, right? One month is good, another is bad. We know that it's not necessarily going to be every month is going to be slow, but that could be one of the thoughts that creates stress, right? You could have a thought that if this month is slow, it means that this is how it's going to be, right? And you can see how that would make you more stressed than someone who's, yeah, it's a slower month, but next month will be great, or whatever it is, right? So we are accepting the reality of the situation, and then we are thinking about, like, what are my assumptions about the number of patients that I see? And then almost like a meta thing of like, what are my thoughts and beliefs or assumptions about the stress itself, right? So I'm being stressed out that my practice is slow this month. What are my beliefs about that stress? Do I believe that I should never be stressed in my practice? Do I believe that stress is a bad thing? Do I believe that stress is going to help me in the situation, actually get me more patients? What is it? What are your beliefs and assumptions about the stress itself? Because we all know that stress can be helpful, right? It can help us feel energized. It can help us get us moving. It can be like a little, almost like a little check engine light on your tank, like something needs to change, right? So it's not always a bad thing, but it can sometimes be unhelpful. So it can be unhelpful when it is just chronic and it's never ending, or it can be unhelpful when it's completely out of proportion to what's actually happening. And that can be sometimes where the expectations come in. If you're expecting that every month is going to be a good month, you are going to be stressed more than someone who just sees it as like, of course it's going to be up and down, right? The let's say how extreme the stress is itself, and then how much we actually have to cope with that is going to change how we feel about the stress. So if it's also something that we feel is getting us to a place we want to be, right? We want a thriving, amazing practice in a couple of years' time, and we know that this is just inevitable, is what we have to go through in order to achieve that amazing thing. We're going to see the stress of those little moments as like part of a bigger thing, a part of a bigger meaning, a bigger purpose, etc. Whereas if we just see it as a bad thing, that can also, we can almost be stressing about stress, like meta stress, right? So there are so many factors that can affect how we respond to the situation itself, and then how do we respond to us being stressed about that thing, right? And both will impact how we experience it and how we move forward and how we use that stress or that situation to actually take action. And then sometimes we want to look at if the question behind the question is something more to do with, let's say, the business side of things, then we want to look at where do we need to take action in that realm, right? So what I mean by that is, when is it actually something that we are lacking skill-wise or action-wise? So let's say, for example, you have a month and it's slower, right? That stress can be good to get you moving, to start doing more things in order to put yourself out there and get patients, right? But if you are doing that on a consistent basis anyway, you know that you're doing everything you can in terms of like marketing, you know that you have a very kind of consistent thing of, this is how I get my patients. If that's already happening and that's already in place, and you know what your financials are, everything business related is like taken care of, and you know how it's working and all that kind of stuff, you are also less likely to be stressed out by the inevitable slow month than someone who is just kind of, I'm not calling myself out here, like don't know much about actually running a business, and we're just hoping that somehow patients will find us or that they will get into our practice. And so when it's not happening, we're like, oh shit, like we don't even really know what to do, or we're only taking action in those times of stress. Like when it's going well just kind of by chance because, you know, things are kind of flowing. And then we reach a slow month and now we like, oh crap, and now I need to like do this and do this talk, or, you know, reach out to this person or whatever it is that we use to for like outreach or getting patients. If we're only taking action in those times of being quiet, that's also going to be part of the reason that it ends up being slower, because obviously we need to take consistent action in that arena for it to like the fruit of that is only going to be obvious later. So if we're waiting for a slow month to take action on that, obviously that's also going to affect our practice. So there's a lot of like different questions from different angles, but we want to kind of get behind what is the specific question that I'm actually asking here. Do I want practices to help me calm down? Do I want practices to help me have less slow months? Do I want to, you know, not have to be stressed every time there's a slow month? What is the actual question behind the question here? Like, let's get really specific. And it helps also when we have a concrete situation in mind that we can actually look at it from a very realistic perspective, instead of having like this nebulous, like, oh my gosh, you know, practice is slow sometimes and we don't know what that means in terms of numbers. How often is it like that? What did I expect it to be, etc. So we're looking at, where was I? Lost my train of thought there. We're looking at different like aspects of this question, right? What are the questions behind this question? Can we get more specific on what exactly I'm asking for and what I want support on? Because that also determines who you're going to go to, right? If you're going to need business advice, or you're going to need, essentially like market or business advice, you're going to look for that in different places than if you're seeking, let's say, kind of emotional support or stress management, tips and tricks, those kinds of things. So let's get clear on like, what is the specific question? And then looking at what are our assumptions about the situation itself. Did I expect that this was not going to be part of this? And how can I be better at accepting that this is the reality of the situation that I've chosen? And now that I've accepted that this is the reality, now what can I do, right? So acceptance doesn't necessarily mean, oh, we just sit back and not do anything and just, you know, are passive about it. That's not what acceptance means. Acceptance means like, this is the reality that I find myself in, and now what? And so moving on to the second question, we want to start in a similar place. So how can we best set realistic expectations with our patients? Again, we want to think about, am I expecting, do I have unrealistic expectations about patients' expectations, right? So the reality is, when we are in practice, some people are going to have expectations. And sometimes those expectations are not going to be accurate. Sometimes those expectations are going to be wildly unrealistic. Sometimes they're going to be completely in the opposite direction, where they're like so surprised that, you know, something good happened. So the reality is that people are going to have different expectations. So we're not necessarily trying to change that, right? We're not trying to go like, how can I make sure that no one ever has unrealistic expectations about the care? We're going, this is the reality of it, and now what, right? So when we're accepting that reality, we understand and remind ourselves that patients don't know anything about, or usually don't know anything about, the prognosis of their condition or their complaint. They don't know about things like trial of care. They don't understand that concept of like, we're going to try this treatment, and based on that, based on your reaction to that, we're going to, that gives us more information and we might change things. They don't understand differential diagnosis. They don't understand that you can't just say it's definitely this with 100% certainty and there are no other options, right? They don't understand that there's variation, right? Someone might have gotten treatment in their family and they think that their care is going to go exactly the same way, right? And I'm not saying patients don't understand this as in like a judgmental thing, right? We shouldn't expect that they understand these things. It's become so like ingrained in us that we almost expect that patients will just get that. And we have to remind ourselves that that isn't necessarily something that they understand, right? If you think of something a little less, you call it like variable than the human body, right? If you go to, if your roof is leaking, right, and you go to someone who fixes roofs and you say, I would like my roof fixed, they come in, they diagnose where that leak is, they fix it, and the guarantee is that that fixing of the roof is going to be solid and they've done it well and it's not going to leak in that same place again, right? That's pretty straightforward. I'm not saying the work is straightforward. I'm just saying the process is straightforward because materials like roofs are much more predictable than the human body. So when someone comes for care and they say, I'm paying to get my body fixed, essentially, they don't understand that there are so many factors that are complicating this process. And so they don't understand why they can't just pay for X amount of things and have a guarantee that that's going to fix their problem and that their problem is going to stay fixed for an extended amount of time or forever. So we really have to understand that by no fault of the patient's own, they don't understand all the different factors that come into care, right? And so it is our responsibility to communicate that to the patient. Now, I'm not saying like this whole long story, like there's only so much, especially in the first consult, of how much you want to communicate to the patient. But I want to just make it clear, like it is our responsibilities to communicate that to the patient. And part of communicating that is getting clear on what their expectation is. And you can ask someone, you can say, like, because there are so many experiences, maybe things that you've heard, maybe, you know, like people go and watch a video on TikTok and then expect that you're going to do the same thing, right? Whatever. You can say, because there are all these variable like expectations, I just want to get clear on what are your expectations for this care. And you can explain to them why you want that answer, because sometimes they might be like, well, you should know, you're the doctor or you're the provider, whatever it is. But making sure that they understand why you need that information and you're not just using it to like decide on their care, right? But you can ask them, you can ask a patient, you can get clear on what are they expecting from your care. And then on that same note, when you understand what they are expecting, that is not now just this thing that you have to fulfill. So that's where we also want to look at what are our beliefs and assumptions about the expectations of a patient and whether we have to fulfill that, right? So obviously, like we're different, we providers in different professions on this group. So I'm just going to use the example of our like manual kind of type profession, PT or chiro. Let's say that a patient comes to me and says, I expect that within 2 treatments, my back pain is going to be gone and it should never come back again, right? I don't have to go, oh shit, now I have to make that happen. No, that is not how this works, right? I'm not asking the expectation of it so that I can just fulfill that and I have to make it work, right? I'm asking that so I know what they're expecting and I know where my education needs to come in. So I can say, you know, that is totally fine if that is your expectation, but this is actually what you can expect. And if you are only willing to come twice, then that's fine. That's your right to do that. But just understand that if you go away after 2 treatments and you are not better and the pain comes back, that is not because I didn't do my job properly. That is not because my care doesn't work or this treatment doesn't work. That is because we didn't fulfill the care that we would have normally applied in this particular scenario. So we want to get clear on what their expectations are. And that doesn't mean that we just fulfill whatever their expectations are. But at the same time, we're not being judgmental about why, or judgmental about their expectations. We're not being, mean about it or, like getting all on our high horse about this. Like, we don't have to make it mean anything about us or our care or anything like that. It can just be a recognition that their expectations are different from reality, and we can communicate and educate them on that. So, that'll be kind of in the area of like, what do you believe about the expectations of patients and whether you have to fulfill them as they are, and whether you believe you can educate them and communicate to them about the expectations. And then part of what we want to look at when we are looking at expectations with patients is I personally have found that we don't learn firstly that much about communication. That's probably the biggest one, but then also about prognosis. I think that's an area that we sometimes are a little bit lacking. Like we're not actually sure on the prognosis as well. And obviously we don't always know for sure. But just as like a part of this is like similar to the previous question, where is it actually like skills and knowledge about like business and marketing and all of that? In this case, it could be, do we actually need to upskill in terms of prognosis, learning how to communicate that to patients, learning the variability of the prognosis for something, all that kind of stuff. So where is it a kind of a skill or knowledge gap, and when is it more a like emotional processing or stress management or that kind of thing? Okay, so the last question. So dealing with difficult patients, setting boundaries without disappointing or losing patients. So again, where I'm going to start with this. We want to be accepting the reality that this is the case, right? There is no answer that I can give you for how to make sure that no patients are ever difficult, and how patients can always be like nice and sweet and respectful and all that kind of stuff. We can't ensure that, right? So we have to accept the reality that if we are going to be practitioners, if we're going to work with other people, we're going to be dealing with people who are difficult. So part of this is looking at what exactly we mean. Again, like, what is the specific question? We want to go, what is the specific difficulty that I'm referring to? And we're all going to have slightly different things that we struggle with more than others when it comes to difficult patients. And part of this is because we have different thoughts and beliefs and assumptions about the things that patients do, right? Some people might have absolutely no difficulty at all with sending an invoice to someone who didn't show up for their appointment. But when that person is speaking to them and being condescending, they might get really angry. So there are different, again, kind of looking at what is the specific difficulty that you tend to struggle with the most. We want to look at the specifics of that, and then we want to look at sorry, so I'm kind of like splitting it into two. We want to look at what are our thoughts and beliefs and assumptions about what that patient is doing, and what are our thoughts, beliefs, and assumptions about the like dealing with that part, the setting boundaries or the reacting, etc. And part of what I notice when it comes to clinicians is we almost have this like ingrained the client is always right kind of attitude. So this makes total sense. That's what we've been taught. But I think we want to realize like you are a human being and you are interacting with another human being, right? Just because you are providing a service to that other human being does not mean that they have the right to treat you not like a human being, right? So when we say the client is always right, or we say something like, but they are paying, right? Get clear on what exactly are they paying for. They are not paying to be able to speak to you like crap. They are not paying to be able to cross over like boundaries that you have set or systems in your practice that they have set, right? If your system in your practice is, if you do not show up for your appointment 2 times in a row, the third one will be charged for. They do not get to go, oh, I'm not going to do that just because they're paying for their appointment, right? You have certain systems and boundaries in place, and they have to adhere to that if they want to be a patient at your practice. That is easier said than done, right? There's a reason why we don't enforce these things. And part of it is reflected in the way that we ask these questions, right? How do I set boundaries without disappointing my patients? How do I set boundaries without upsetting my patient? How do I set boundaries without losing any patients? So there are a couple of assumptions in here, right? And we want to look at what are the assumptions that we make around boundaries themselves. Often when we are people who struggle to set boundaries, what happens is we keep quiet. This is like in personal life, sometimes in professional life as well. We don't set boundaries. We don't, we kind of accept things until the point that we can't anymore. And then we kind of freak out or blow up, or, we get to like that boiling point where we just can't anymore. And then we get mean, and then we get crappy, and we get bitchy, and whatever word you want to use. So often we also think about setting boundaries in that context. Like if I'm setting boundaries, it means I'm being mean. It means I'm being harsh. It means I'm being, like we have so many negative, maybe selfish can be one of the things. So one of the exercises you can do is start to think about like, what do you associate with setting boundaries? And setting boundaries does not have to be any of those things, right? Setting boundaries is just saying what you personally are going to do in a certain situation. So if a patient does X, you are going to do Y. That is a boundary. A boundary is not, you are not allowed to do X, right? Because you cannot control someone else's behavior. All you can say is, if you're going to do X behavior, I'm going to do Y. And that does not have to be mean. That does not have to be, I'm trying to think of synonyms without being bitchy all the time. But anyway, so we don't have to be mean about it. It's not rude. It's not selfish. So again, we have this like assumption about setting boundaries that it's going to inevitably end in disappointment or losing patients or them getting upset. And part of that is because we see it as like this mean or selfish thing, right? But it's just saying, this is me protecting my energy and my practice, and this is how I've decided to work so that I still work with pleasure and I enjoy my work. I can be compassionate towards my patient because I've set boundaries. So that's part of it. And then if it does end up disappointing or upsetting, or end up you losing a patient. Part of the assumption around that, or the belief around that, is that I can't handle that, right? And let's be honest, like, we're losing patients all the time, even if we're not setting boundaries, right? Sometimes we just lose patients. Sometimes patients are upset because they misunderstood something that we said. Sometimes patients are disappointed by something that was completely out of our control. Even when we are not setting boundaries, some patients will be disappointed. Some patients will be upset. Some patients will decide to leave the practice, right? Those things are happening even when we are not setting boundaries. And sometimes they even happen because we are not setting boundaries. Because if you are so frustrated and resentful because everyone keeps on constantly crossing your boundaries or taking advantage of you or whatever, you end up showing up in a particular kind of way. You are less able to be compassionate, genuinely compassionate towards your patients. You are less able to show up fully because you are not energized and engaged. So you sometimes end up losing patients because of the way that you interact with them as a provider, having no boundaries, and feeling fed up and resentful and frustrated. So I just want to separate those two as well, that you are sometimes losing patients, sometimes through nothing that you did, something that they misunderstood, or something that they just chose to do. They just decided to go to someone else, or they were better and they decided not to come back, or they moved to another place, whatever it is. We're losing patients all the time, and not necessarily through us setting boundaries. So realize that it has happened before. You've disappointed patients before. You've lost patients before. You've been able to handle it. And it doesn't always necessarily just come from you setting boundaries. So that was a lot. I hope this felt like there was some structure to that. But essentially, with all of these things, we're looking at the question behind the question. So getting more specific on what exactly am I asking for? If someone had to just give me advice, give me a tip, whatever, what would I actually want them to give me advice on? Because that gives us more clarity on what we actually are looking for. And it also gives us a little bit of a clue of, like, are we accepting the reality of the situation and moving ahead with the acceptance of that reality? Or are we trying to push away that reality, push away discomfort, push away negative feelings, push away having any stress at all, and everything must just always be like great, everything must go smoothly, everything must be fantastic, right? Are we accepting or denying the reality of the situation? And then where do we have certain thoughts and beliefs and assumptions that we can start to look at and start to question and start to think, is that actually true? Is it true in all situations? Would someone else agree that that's true? Thoughts, beliefs, and assumptions about the situation itself, and then like a meta version of that, like what are the thoughts, beliefs, and assumptions about the discomfort, or about the stress, or about the disappointment, whatever it is. Do I believe that that shouldn't be there, or that I believe that that means something about me, that I'm doing something wrong, or that I am practicing in the wrong way, or whatever it is? What thoughts and beliefs and assumptions are we making about those things? And then just getting clear on, like, where do we actually need to upskill in certain areas? And where is it more kind of us being able to emotionally deal with that situation? So I hope that was helpful. Let me know any more questions that you have about that, or anything more specific that you want me to go into about those things. And I hope that just gave you a little bit of, a few things to kind of reflect on and think about, and let me know what you discover in that reflection as well. So have a great Sunday, and I will see you guys soon.